Welcome to this session of the North Central Farm and Ranch Stress Assistance Center webinar series, presented to you by the National AgrAbility Project, which is headquartered at Purdue University. My name is Paul Jones, and I manage the National AgrAbility Project. Our topic today is an overview of Native American behavioral health issues, and our presenter is Raymond Daw. He is a Native American behavioral health consultant from the Dine Navajo Nation. A little background on USDA's Farm and Ranch Stress Assistance Network, which is commonly known as FARSAN. It was first authorized through the 2008 Farm Bill, and its purpose is to establish a nationwide network for farm and ranch stress issues for anybody that's in agriculture dealing with stress. And there are currently 4 regional FARSAN centers across the United States, covering every state and territory. If you'd like basic contact information about those centers, you can go to agrability.info/FARSAN, FRSAN. For those that might not be familiar with AgrAbility, we are sponsored by the USDA, and our focus is on helping people in agriculture that have some kind of disability or functional limitation. Currently, there are 21 state projects around the country. Every one of those is a partnership between a land-grant university and at least one private disability services organization. Again, there's one national AgrAbility project. Our main purpose is to support those state projects and offer some limited services to those who live in states that do not have AgrAbility projects. Again, it's the National AgrAbility Project is headquartered at Purdue through the Breaking New Ground Resource Center. And our partners on that grant include Goodwill of the Finger Lakes, Osteoarthritis Action Alliance, AgriSafe Network, Colorado State University, and Washington State University. You can find out much more information about AgrAbility, and you can view over 140 archived webinars on the agrability.org website. Again, our presenter's Raymond Daw, and he's got some of this information already on some of his slides, so I will not read all through that for you. But at this point, I will turn things over to Raymond, and I would plan to return after the main presentation for the Q&A period.
Thank you, Paul, for your overview and introduction. This afternoon, our time together is supported by the Center for Behavioral Health, which is housed at the University of Iowa. And they're supporting our time together today. Next slide, please. The Center for Behavioral Health is a project that's funded through the Substance Abuse and Mental Health Services out of Rockville, and has an extensive network of Native American consultants and providers as part of the team at the University of Iowa. Next slide. First, we do a land acknowledgement. This is the map that shows generally how land was used across North America prior to colonization. I won't take the time to read it, but basically this land acknowledgement was developed by 3 Native workers with the Native Center for Behavioral Health. All 3 are members of the Meskwaki Nation in Iowa and 2 Winnebago Nation peoples. But this is what we do generally to acknowledge that the lands we are all living on and working off of are formerly lands of many, many tribes. So thank you. Next slide, please. The Native American Center for Behavioral Health is part of a larger network called the Technology Transfer Centers that is funded by the Center Substance Abuse and Mental Health Services in Washington. Their regional centers as indicated in the map by color, but are also several ethnic specific centers that are part of the system: the Native American Center, the Hispanic Center, and the Pacific Islander Center. So we're part of a larger system, is basically what it is. Thank you. Next. And more information on the Substance Abuse and Mental Health Services Administration and how this is supporting a number of efforts across the United States. Thank you. Thanks. This is me. Go on, we'll move on to the next slide. Since we're all getting copies of the slides, I'm not going to spend a lot of time on some things, but next slide, please. Who am I really? I am, my people, we have a clan-based relationship system. It is a matrilineal system that we have. And this is the matrilineal system of clans that we have among my people, the Navajo people, defines really who we are as Navajo people. There are a number of native tribes in the United States that also have clan-based relational systems. And these are my 4 clans. Because we're matrilineal, the first clan, which is Tarawih House or Kiani, is my mother's primary clan. The second clan that's listed there, Tlizasana Mendigos clan, is my father's primary clan. The third clan that's shown there, Sitnagini, or Blackstreet people, is my mother's paternal clan. So the Sitnagini people by clan are my grandfathers and grandmothers. The Twitachini clan, the fourth one, or Bitterwater people, are my paternal grandfathers. And any person who has the Bitterstreet clan as their primary ends up being my paternal grandfather or paternal grandmother. And that's how we're structured among Navajo people. And this defines who I am. So whenever among my people, I am obligated to introduce myself with these 4 clans first, and then other information afterwards. Next slide, please. So we have 4 objectives here in the next 45 minutes that we have together. First, to provide a historical overview of Native American lifestyle and cultures. Second, provide an overview of Native American mental health disparities. Third, describe Native American cultural considerations for improved mental health. Fourth is traditional healing practices. So these are the 4 objectives that I'll be going through in the presentation that we have. Thank you. Next. Objective 1 again. Next slide. This is an interesting set of maps. The map on the left, which was shown in the land acknowledgement section, is generally how tribal land is described when people talk about Native American country prior to colonization. So it's the impression this gives that tribes had distinct boundaries that they lived in. You know, like the Athabascan people, which is up north, and Brown, the impression that they lived only in those areas and that other people lived around them. Actually, that's not true. Land use is better described in the map on the left, where you see a lot of intersection and interaction between quote unquote tribal land in what is now considered the 48 states in southern Canada. But we'll see a lot of sharing of land. Land use was not proprietary, or tribes didn't own land, and oftentimes they used land and shared that land with other people around them. We know this from our histories and the stories that we have. My people, Navajo, we resided in the Four Corners region. We knew of basically all the tribes from California all the way to on the other side of the Mississippi River. We knew them. We knew who they were. We had names for them. We knew tribes all the way up to Canada and all the way down to Mexico. And that's the kind of interaction that our tribes had. If you explore Native American trade routes, you'll see how extensive Native American trade routes were prior to colonization. So there's a map that I shared to show how land use is different than generally depicted. Next slide, please. First thing is, we hear the term federally recognized tribes, and sometimes we get a question on what that really means. The federal government recognizes 574 Native American tribes in the continental U.S. and Alaska. These federally recognized tribes are recognized as having certain inherent rights of self-governance, and therefore entitled to receive certain federal benefits, services, and protections because of their special relationships with the federal government. And this government-to-government relationship that exists between the federal government and tribes has responsibilities and powers and limitations and obligations that are sometimes very well defined and also strictly followed by not only the federal government, but also tribal government. The other thing I can tell you that some states, particularly California and Alaska, have quite a few federally recognized tribes. Alaska has about 224 federally recognized tribes, for example. Almost 40% of all federally recognized tribes are in Alaska. Next slide, please. Next slide. Yeah. So this map shows where the federally recognized tribes are in the United States. And you'll see some states that do not have federally recognized tribes. Those are the states that are colored in gray. But you'll see most of the federally recognized tribes are in Alaska and the Western United States. Then there's another category of tribes called state recognized tribes. The state recognized tribes are states that have tribes that they recognize only, not the federal government, are shown in orange. You see Texas has some, Louisiana has some state recognized tribes. Mississippi as well has state recognized tribes. So this is a map that's really interesting, and I think helps begin to delineate how federally recognized tribes and state recognized tribes have different roles and functions within the different governments within this country. Next slide, please. So one of the misimpressions that's there is that all Native Americans live on native land or reservations, and that's not true. It's real important to acknowledge that a significant majority of Native Americans, 70% of Native Americans, live off reservation, generally in urban communities like Minneapolis, Chicago, New York, Atlanta, Los Angeles, Oklahoma City. These big towns, big cities have significant Native American populations. Albuquerque, New Mexico has about 27,000 Native Americans there, for example. And that's generally how tribal population is spread out these days. And a lot of that change that happened from reservation style living to urban communities happened because of a couple of probably three primary federal policies that happened. First of all was the boarding school system, where, and we'll have a little bit of discussion on that later. But the second federal policy that really had an impact was the relocation program, where Native Americans who lived on reservations were encouraged to sign up for a program that helped them move to urban communities like Los Angeles, where they were able to get jobs and begin to set up lifestyles in these bigger cities. And a lot of migration happened from reservation to cities back in the 50s and 60s. The second program that happened is foster parenting. A lot of Native American kids have historically been put into foster placement with non-Native families, and as a result of that foster placement of Native children into non-Native families, a lot of these Native foster children end up setting up homes and work and going through school off reservation. So those are the three primary ways that Native Americans have ended up being largely living in urban communities. Next slide. Here's a question for you to look at and respond to in chat. And later on during the Q&A piece, if you feel like having a response that you put in chat, we can have a discussion on that at the end. But I wanted to present this question to each of you on which tribes you have interacted with professionally. So you can put that your response in chat. Next slide, please. Thank you for your responses also. Now we go to objective 2, where we're going to look at an overview of Native American health disparities. Blackfeet, huh? Cool. Next slide. Earlier, I mentioned 3 federal programs that had a significant impact in moving American Indians, Native Americans from reservations to urban communities. One of them we talked about, as mentioned, as being boarding schools. There is a topic that has become really important in Native American communities, policy, education, and that topic is historical trauma. I was at a Hispanic Latino meeting yesterday in another region, and the Hispanic Latino community that was there talked about historical trauma. So the historical trauma discussion, although first generated about 30 years ago by Maria Yellowhorse Braveheart and Maria de Bruin, as a way to describe the chronic legacy of trauma and unresolved grief across generations, has become a cornerstone of how we begin to look at how many Native American lives are impacted today from those instances that result from colonization and policies that were heavily geared towards forcing acculturation and forcing assimilation. And mental health of our ancestors were adversely affected by those traumatic experiences of genocide and forced removal from traditional lands. And here's how mental health is affected in this graphic. Next slide. Another significant part of the Native American historical trauma experience is that this is a study that comes out of the World Health Organization, I believe, and it is widely accepted and generally known that smallpox, from the time of first contact and when Columbus mistakenly landed in the Caribbean, that from that time forward, that smallpox killed 90% of Native Americans, not only in North America, but in Central America and South America. So smallpox had a very devastating effect. Native American populations across the three parts of the New World. And it has such an adverse effect on population, the world's population, that there are studies that indicate that that there was that significant drop in population on the Western Hemisphere created climate change in the northern hemispheres of Europe and North America, and that contributed to some of the famine and devastation that happened in the 1600s and into the 1700s. So it's a pretty significant event. So people wonder sometimes how today we end up with probably around 2.5 million Native Americans in the United States. Well, historically, going back to the 1500s, the Native American population in these lands were quite a bit higher. Estimates run from 30 to 60 million Native Americans living just within the 48 continuous states at that time. Next slide. Talked about boarding schools. Well, it was a major federal policy in the 1800s and on to about. Sorry for the interruption. I was using my iPad and it overheated, so I changed to my cell phone. So we can go ahead and forward the slide. The historical trauma model that Maria Yellowhorse Braveheart really has 4 parts to it. Not only is it about talking about the historical trauma, the adverse events that happened prior to our lifetime, it also talks about how we and who live today acknowledge the impact of those traumatic events on our ancestors. But the third part of the historical trauma model, which is really important, also is about releasing that pain and not living in the horror and the trauma and the grief that comes from having ancestors experience that, and it still has an effect on us today. I'm a boarding school graduate, as I mentioned, and a lot of my time and my life has been around not putting a lot of thought and energy to reliving those experiences that I encountered when I was in boarding school, and being a better person. And that's where we come to transcending the trauma. Transcending the trauma is about being a good human being, taking care of ourselves, and acknowledging that we have lives that we can contribute in and have our roles in. Thank you. Next slide, please. Is a reiteration of the assimilation and acculturation approaches that were applied for over 100 years. And we're talking about 4 or 5 generations of Native American populations that were affected by this kind of forced assimilation and acculturation policy. And that has an effect. There are studies that indicate that American Indians appear to experience traumatic events at a higher rate than previously reported in the general population. There are some recent work around what is called adverse childhood experiences, ACEs, which I encourage you to look at in terms of understanding how childhood trauma does have an impact in later life, if not healed or treated effectively by grounded, healthy, empathetic providers. And that's necessary to heal and recover from the trauma. Next slide. Assimilation, I mentioned, was very pronounced. This was a picture of a sign that was actually on the Navajo Nation for a lot of years. And this sign is that tradition is the enemy of progress. was a sign that was message that was placed in different parts of the Navajo Nation. I remember seeing a picture of this sign in a billboard form in the middle of Window Rock, Arizona, right on the corner where 3 roads intersect. And so in the 50s, this was very much federal teaching to Native American populations, not only on Navajo country, but across the United States. Next slide, please. Acculturation, all of us in this country have experiences with how we acculturate to the different parts of society or the different regions that we reside in. We all have that experience. With Native American people, it becomes even more pronounced because a number of us, good proportion of us, and you'll have exposure to what that might look like in the traditional healing piece, but a number of us follow our traditional ways. I, for example, follow the Navajo cultural, spiritual ways of my people. I'm not a Christian, nor am I Buddhist, nor am I Hindu or any other thing like that. I follow the Navajo spiritual ways. So I'm a very traditional person that way. On the other hand, as you're experiencing today, I'm quite assimilated in the Year American system to be able to join you on Zoom and be able to give, I hope, an insightful and productive presentation to you in English. On the other hand, I'm also very literate and in Navajo. I speak the Navajo language fluently. So not only am I fluent in Navajo, I'm also very fluent in English. And that's the way biculturalism works for quite a few of us who are Native American in the United States. Next slide, please. When I saw this report 2 months ago, it really had a profound impact on me. The report from the Center for Disease Prevention out of Atlanta is that Native American life expectancy dropped 5 years recently, now. And the first question that comes to mind is, what happened? Well, one of the major impacts on Native American life expectancy dropping 5 years recently is number one is COVID. The pandemic had a significant effect on many Native tribes in the United States. A lot of our older people passed because of COVID, and we have a significant portion of our populations who are diabetic, who are obese, and have alcohol-related conditions like cirrhosis or kidney disease that are not, those are not good illnesses to have in the middle of when you have a pandemic going on. And there's recurring problems with respiratory illnesses across the Indian country, let alone having to deal with something like COVID. So the other thing I can share is that while Native American life expectancy dropped 5 years, most ethnic groups in the United States saw some drop in life expectancy recently, some more than others, but Native American life expectancy decrease was more than all other ethnic groups in the United States. And I and a number of us who work in the health field, behavioral health field, are having discussions about what this means from a historical traumatic perspective and from an adverse childhood experience perspective, but in perspective of how we ground ourselves and our people a lot better so that our immune systems are more intact and healthier. Next slide, please. Suicide has been a major problem among Indian country. There are some tribes that have suicide death rates that go as high as 55 per 100,000. And there are some tribes that don't have that have suicide death rates that are more similar to the general population. So there's a wide range in terms of suicide death rates, but quite a few of our tribal members have higher death rates than that are 2 or 3 times higher than the national average. And you'll see a comparison of that in the graphic below. Next slide, please. There are studies that continue to indicate that the major mental health disorders that are among Native American people are higher depression rates, higher rates of anxiety, and higher rates of substance use disorders. One of the interesting facts about substance use disorders or alcoholism, for example, is that we have studies in Indian country that indicate that Native American people have higher rates of abstinence compared to other ethnic groups. Now think about that a bit. On the other hand, we also have higher rates of alcohol abuse in comparison to other ethnic groups. So it's an interesting dichotomy that exists around higher abstinent rates among Native Americans, but also higher alcoholism rates among American Indian people. What that means is that we have fewer of our people who are social drinkers, number one. And that's one of the impressions that I want to leave on you is that we have a lot of sober people, but also we have a good portion of our people who are abusing substances like alcohol, methamphetamine, fentanyl, and other drugs that are available to all of our people. Next slide. These problems that are associated with historical trauma, adverse childhood experiences, problems with acculturation, assimilation, and high substance abuse rates impact some of these conditions that are shown in this slide. Among the Navajo people, my people, our unemployment rate is around 50%. And that's true for some reservations. There are other reservations that have unemployment rates that are a lot better. Domestic violence rates among some tribes, not all tribes, is really high, and among other tribes is not that high. Lately, we've been looking at the impact of forced slavery, sex slavery among American Indian people, and trying to create strategies and have policies created to better protect our young women from kidnapping and forced into sex slavery or their body parts being sold in the black market. All of this has a relationship to how it impacts our mental health and well-being and impact of grief. Next slide, please. I have a question here that you can look at and think about, and maybe have a discussion about this later on. How is Native American history different from your ethnic history? It's a question to consider. And a lot of us are multi-ethnic. That's the way American life is these days. We have a lot of intermarriages among our different peoples. But that's a question to think about. Next slide. In objective 3, we'll look at Native American cultural considerations for improving mental health. Go ahead, please. What are strategies to meet the mental behavioral health needs of American Indians? Well, there are two approaches. One approach is to apply the Euro-American system, which is grounded on the DSM-5, the manual or the psychiatric Bible that psychologists, psychiatrists, and therapists use when they provide treatment or help with anybody that comes into their office. The second approach that is really resonant with the majority of Native Americans are traditional practices, traditional approaches. And we're seeing the really nice growth in understanding and application of traditional Native practices across many parts of Native country, but also in urban communities that provide services to Native Americans. But these are the two processes to look at in terms of thinking how to help a Native person or any person. Hispanic population have traditional practices too that is sometimes not talked about or even considered when working to help persons who are Hispanic, let alone Native American. Next slide. One of my mentors is a gentleman by the name of Dr. William Miller out of the University of New Mexico. He's a spiritually grounded researcher out of the University of New Mexico, and has written a number of studies on how to integrate spirituality into treatment. What I like about his work is not only that he developed motivational interviewing as a grounded practice, but that motivational interviewing is now a widely accepted way of providing help, behavioral health help to people who are experiencing trouble. It's a tool that's applied not only in the United States, but across the world, and has adapted into a number of different languages. And the grounding for motivational interviewing comes from Dr. Miller's own spiritual grounding and his approach to thinking about empathy and caring. But and that really resonates to how we in Native traditional circles look at our lives and the lives of other people that we encounter. Next slide, please. What is culture? Well, culture we sometimes just see as the tip of the iceberg. It's how people look and how they dress, how they speak, the holidays they practice, food they eat, and the language. If you met me in Chicago, for example, you'd see me eating probably the same kind of food most people eat. You hear me speaking English like this and talking Euro-American folklore or Euro-American folklore and things like that. But outside of that are those parts of culture that we don't see, like how our family roles. I'm a patriarch in my family. I'm the eldest. And as a patriarch, I have very significant roles in my family that guide who I am, what I do, and what I don't do with my family. I have siblings that I'm responsible for, a lot of nephews and nieces who are my sons and daughter in the Navajo way, sons and daughters that I interact with a lot. And we have a process of taking care of each other that is sometimes different from the Euro-American system. And the system that we have is about having a contemplative approach to our world and the environment we live in, so that we end up being more grounded relatives and people, human beings to each other. Next slide. I'm going to offer a tool if you're interested in thoughts and ideas around approaches to Native American, Indian, Alaskan Native spirituality. I'd point you in the direction of TIP 61, or Treatment Improvement Protocol 61, has that title, Behavioral Health Services for American Indians and Alaskan Natives. It was developed a few years ago, and is a really good tool on broader understanding of a lot of what I'm talking about right now. The TIP is a booklet about probably a couple of inches thick, and it's developed by probably close to 40 Native Americans, if not more than that, across the United States. So a lot of us, myself included, had a role in the writing and development of that particular manual. Next slide, please. Tip 46 is one of those pages that really stands out in terms of understanding how we as providers, it doesn't matter if you're in agriculture or psychology or economics or government, but it's about understanding how we relate to each other and how the differences that we have can be understood and help us guide our common existence together. Next slide, please. The third question here, what are your cultural roots? Is a question that I can offer here for you to think about and to have a response to in chat. Culture, all these things, and we understand ourselves according to how we dress. I don't have a suit, for example, so I choose not to show that. I choose not to adopt that part of your American culture in my work, in my life, by not wearing a suit. I don't value that as a way to live and be. Next slide, please. Ten more minutes. Objective 4, we're going to do an overview on traditional healing practices. Go ahead. Here's a description of what is considered traditional. It's tribe-specific. There are 270 plus tribes in the United States, 470 plus tribes in the United States. Well, each tribe has its own way of doing traditional practices. And there's some overlap across regions between tribes, but there's a lot of variation to that thing called traditional healing. Next slide, please. Native American veterans, as an example, do prefer traditional healing practices, and as a way to, instead of your American approaches, to heal from the emotional stresses of having been in the military, grief, PTSD, adjustment disorders are major problems that veterans encounter. And right next to it is a map drawn by a dear friend of mine out of Oklahoma, Dolores Bigfoot. If you want to have some really nice insights on Native American trauma and childhood trauma in particular, look up Dolores Bigfoot. She's a really great writer, thinker, and there's a graphic she designed showing how traditional healing practices can be categorized or clumped into different categories for us to consider in our teaching with each other and our discussions with non-Native Americans. Next slide, please. Native traditional practices can be herbally based. These are the different kinds of traditional healers that are out there. Yesterday, I had a real great experience of seeing a Latino traditional healer doing herbal work and doing massage work with people that were at a pretty good sized meeting, and the time she was there for like 6 hours, she was busy. People are just standing in line to have her help. So these are some of the ways that we look at as supporting our physical well-being, our emotional well-being, our mental well-being, and then our spiritual well-being. Next slide, please. Oh, wow, Scottish. Thanks, Craig. What are some traditional approaches that exist to deal with anxiety, for example? Well, prayer, talking to a trusted relative, seeking support or help, being fit, taking care of our physical being, and singing songs. When you look at this list, it's not that much different from what is taught in churches. In churches, we're encouraged to pray to God, to speak with family members or the preacher or the deacon. When we encounter stresses in our lives, and to be and to seek help when we feel boxed in or have problems that we may be having difficulties finding answers for, but also to take care of our physical self, take care of ourselves. And the nice thing about the church way, the Judeo-Christian way, is that songs are a big part of being a Christian. And so it's not that menu that I'm showing here isn't that different from a lot of spiritual practices that are out there. Next slide, please. When we practice our beliefs, we end up kind of wondering, is that really serious, or is that really true, or where does it come from? You know, and we do this every Christmas. You know, every Christmas, a lot of families get ready for Santa Claus to bring gifts and teach children that Santa Claus is coming, and you have this countdown and the tracking of Santa Claus across the world, things like that. In the meanwhile, we have ways in Indian country that are really pronounced in our thinking and shaping of how we look at the world and each other. Next slide. There are a number of herbs that are available to us to make use of. Those of us that closely tied to our traditional ways make use of these herbs. I'm one of those who, if I'm not feeling well, I don't go running to a doctor or take prescription meds or off-the-counter meds. I tend to move towards, looking at the herbs that I have in my room, in my bag, and using them to get through the symptoms that I'm encountering. But a lot of it is around really taking care of our immune systems so that when an illness does hit us, we're not as badly affected by it. Next slide. So these teachings really are about how these negative feelings and emotions that we have are to be fought. We overcome them. We don't let them take over our lives. And we find ways not to let that happen. And have these ways that I showed in the first slide, strategies, I guess you could say, to be that way, to be good people and strong people. Next slide, please. One of the major tools we have right now in the United States is 988, and I wanted to show this slide as an example of a very nice tool that's available to all of us in the United States to be able to, number one, help each other, support our family members and relatives who do have emotional troubles. It's not just Native American people across the United States, and be able to get some support with that. And I encourage you to find out what's going on with the 988 system in your state, your region, your community, and help get the word out so that we can have people who are isolated, fearful, in pain reach out to a system that's developing really well out there. Next slide, please. Q&A. Any questions, anybody?
Okay, we will spend some time with Q&A before we wrap up today. I'm going to turn things over to Chuck Baldwin, who's monitoring the chat. And if you have other questions, feel free to go ahead and enter those into the chat, or you can use the raise hand icon, and we'll do our best to unmute your microphone. So, Chuck?
Thank you. The first couple of questions, actually, I think are geared towards Paul. Has the survey link been sent? And is there a link to the PowerPoint?
Mm-hmm.
Yes, I did respond, and I will go ahead and put that survey link in again. And we plan to put the PowerPoint in with the archived version when we get that up on the website.
Can you go ahead and show the next slide too, Paul? This is contact information. We're going to run out of time in a little bit, so I want to encourage you to send me an email if you have any questions, and include Paul if you can. And I'll be happy to continue this dialogue beyond this time we have with each other today. Thank you.
Thanks,
Chuck,
Ray.
we do have a raised hand, so I'm going to go ahead and unmute Robin. Hang on here.
Hi, good afternoon. Thank you for the presentation. I just wanted the name of the author of the Kill the Indian book, Kill the Indian, Save the Man book.
I'm not quite sure about that.
That's fine.
Yeah, I'm not quite sure about who the author might be. I'll have to look that up. Refresh
That's
my memory. Thank you.
I can look it up. I was going to try to get both of the books that you mentioned.
Okay. Thank you.
We do have a couple of other questions. One of those, how important is it for Native Americans to receive mental health treatment from Native Americans? Is there a lower acceptance or success of treatment if it's provided by non-Native Americans providers?
Very good question. That depends on how strongly that Native American person is acculturated and assimilated into the American ways. If a Native American person is living in a non-Native fashion, being highly competitive and has little or no idea about their traditional roots or history or practices, and they would respond more effectively to standard psychotherapy. On the other hand, if you have someone who has some grounding or significant grounding in traditional practices, then a Native provider is more appropriate. And the best way to find out which way to go, once again, is in the initial discussion on where a person is coming from for support. Assessment. So that's the best way I can answer that. But we have a lot of Native professionals who are getting into the behavioral health field every year.
Great. Well, we do have one last question. Do the tribes address mental health issues individually, or is there collaboration between tribes about resources, techniques, etc.?
That's varied across the states, but a lot of tribes do have a lot of collaboration. I showed the 988 slide earlier. Here in New Mexico, we have 23 federally recognized tribes, and we have a major intertribal collaboration going on teaching, educating, informing, and towards getting our people to use the 988 call system as a way to reach out, and also as a way to get into a tribal behavioral health system. So the 988 system is bringing a lot of tribes together across the country. Well, in Washington State, the tribes are collaborating to create a native 988 call center. So when somebody who lives a Native person living in Washington calls the 988 line, they will get a Native American on the call. The same is happening within a couple of other states as well. So there's a lot more work happening these days, I think. Thank you.
Okay, we have had a couple of late questions come in.
Yeah.
Can you speak on how a member of the medical team might respectfully approach someone with concerns?
Well, a good way to begin is to if you believe someone might be Native American, ask the question, are you Native American? And ask them if they follow traditional tribal ways or not. If they do, then that's when you want to ask where they get support generally. If they say they don't follow traditional ways, then you would probably want to steer them towards a clinician that might be attached to the hospital.
And the last question is somebody wondering about the work of Eduardo Duran on healing of the soul wound compared to the book you shared from Dr. Miller.
Well, Dr. Miller's book is targeting the general field of psychology, the broader world, let's say. Duran's book is geared towards Native American people. That's how they end up being worded differently, titled differently. But at the end, they're grounded similarly. Thank you.
Well, that's all the questions we have.
There's a question on Carlisle School. One of the great ways to begin looking into that is do what a lot of us do is Google Carlisle Indian School and boarding schools, and you'll get a whole bunch of resources through the internet. Thank you, everyone, for joining us.
Thank you, Ray. We appreciate all your expertise and for sharing today, and appreciate everybody's attendance. So again, we plan to get this recording up hopefully within the week, and we will let you know when that's available. So with that, we say thank you again, and we wish you all a good day.
Yeah, take care of yourselves. Thank you.
Thank you.
Well, appreciate it.
Thank you, Ray.
Yes, sir.